now are carrying these CBD-rich strains or CBD-rich products, but you still need that medical marijuana card to get through the door of the dispensary to get access to those products too. They are still regulated. CBD is going to be excellent for easing pain, suppressing muscle spasms, reducing inflammation, reducing blood sugar levels, controlling seizures, and easing nausea. They're finding with their research that the CBD cannabinoid and the THC cannabinoid both are very, very beneficial, almost finding more uses with the CBD cannabinoid. So it's going to be cool to see where this goes in the future and what we start doing with it. So you now know you've got these different types of strains and they have different effects on the body, and the bud tender the dispensary you go into will explain that to you. And then the next question is going to be, or I would ask folks, is how are you willing to use it? And we have lots of different ways that we can use it. The first of which is inhalation. So if you use a pipe or a joint or a water pipe, or if you use a vaporizer. When you inhale it, it's absorbed into your bloodstream through your lungs. And vaporization is the preferred method of those two because it actually will remove the carcinogens that you would get from the smoke of a pipe or the smoke of a joint. Inhalation, though, is great because it's an immediate onset. So if there's something going on and you need immediate relief, and like every other medication out there, you've got to wait 30 minutes or an hour for it to kick in. Inhalation, you'll get an immediate onset, and the duration isn't too long. It'll last like 1 to 3 hours. The other source that people have a lot of contention with these days is edibles. And I have a couple here that I can pass out and show you. Before I pass these out, notice the labeling on here. You're going to see a milligrammage. Red label, it says 180 milligrams. The yellow labeling here, 120 milligrams. So take a look at those two. One is a drink. I'll come back over here. One of those is a drink. A liquid edible, whoever thunk it. They're making edibles in a lot of different formats. The other one is called Space Rocks. That is Pop Rocks, but it's medicated Pop Rocks. Reason Ari and I like those types of edibles, and from this particular edible line, is that they're very well dosed. So edibles are a good thing if they're well dosed and if you take the right amount. And this is when it went recreational in Colorado, not what the focus was. It was like, woohoo, let's eat a cookie, and that cookie was actually 3 doses, and now you ate the whole darn thing and you're not feeling so great. It's not going to kill you, but it's definitely not going to make you feel so great for a while. So again, when you go into the dispensary, the bud tender is going to help you dose that out and tell you what milligrammage to stick with, and then you can do the math. And I even cut up chocolate for some of the elderly patients that we had, because one chocolate bar could be 20 doses. But they didn't have the ability or the dexterity to cut that up. So we would do that for them. You know, the people that work in dispensaries are extremely compassionate. So, you know, if there's help you need, let them know. The inherent effect of an edible is going to be tiredness. So a lot of people use edibles to medicate for insomnia or severe and chronic pain, because it obviously kind of relaxes your body enough, it gives you a body buzz, and it takes pain away. But it is going to make you tired. If you take a lighter dose of an edible, though, my father actually uses it for acid reflux disease. He just eats a teeny tiny piece of chocolate. It's maybe 3 or 4 milligrams. It's teeny. Doesn't feel any of it, but it gets the cannabinoid into his system, and it calms that acid reflux down. So there's different ways that you can use them. They can be very effective. They're going to take, though, a while to kick in, and so that's why a lot of people overdo it. That juice edible will kick in about 30 minutes to 45 minutes, but not fully till an hour. Or chocolate or a brownie, it's going to take about 2 hours to fully kick in, so people get impatient. But we tell people that when they come into the dispensary. Take this 2 hours before you want to go to sleep. And by the time you're ready for bed, it's going to be in full effect, and you're going to get the rest you want. The edibles are actually absorbed through your intestine. So edibles are also very good for folks with Crohn's disease, which is one of our approved AMMA conditions. because they're absorbed into the bloodstream through the intestines. They'll take up to, or excuse me, the duration that they last is up to about 12 hours. So again, keeps you asleep through the night, but if it's something that, you know, you can't have in your system for, or, you know, have the intoxicating effect for that long, you know, you just have to know when to use it. It does last a while though. Sublingual administration would be something like this here, which is tincture. This is an excellent option for elderly patients and for children. This has a dropper, and the dropper is marked with 0.8 ml. And on the bottle back here, it tells you there's 35 doses in this bottle. Each dose that you take of 0.8 ml is 20 milligrams of THC. We carry this type of a tincture also in a CBD-rich blend, where you can take the tincture and get the majority of the active cannabinoids within it are actually CBD, so it's not psychoactive. This tincture would take about 30 minutes to an hour to kick in. You would fill the dropper up, squeeze it, squeeze the liquid under your tongue and hold it there. Because the way it's getting absorbed into your bloodstream this way is through the blood vessels underneath your tongue. Sublingual administration. So hold it under the tongue for 60 to 90 seconds if you can, and then swallow it. And that's it. You're not smoking anything, you're not taking in extra calories maybe that you don't want from an edible, whatever the reason is, and it's really easy to dose. It's really clear. I think this is the future for a lot of cannabis therapy. So I'll pass this around too.
I'd like to say we are running a little bit over time. I do want to get Ari's in for 15 minutes or so. If you guys can stick with us, we're a little bit over schedule.
I have like one more method of use, and then
your presentation is wonderful, my dear. I don't want to cut you off, but I just want everybody to know what's happening.
Sure, no problem. There's other sublingual products out there. They're developing more and more of these. Sublingual, and the next one we'll talk about topical. These are a little bit newer, but there's dissolvable strips.